The diabetes and obesity epidemic is spreading rapidly, affecting not just urban areas but also rural communities, children and pregnant women. Behind the growing numbers of weight gain lies silent threats like fatty liver, heart attacks and strokes. What's driving this crisis? Is it our changing lifestyle, polluted environment or unhealthy food choices? Can we reverse these metabolic disorders early? Will intense diets, weight loss drugs and exercise suffice? Or do we need cleaner air, unprocessed food and greener surroundings to heal our bodies? On our special show, Power of Prevention, we'll dive into these critical questions with our experts today. The question today is, can we prevent these conditions if we act in time? Let me introduce our guests. Joining us today, we have with us Dr. Anoop Misra, Executive Chairman, Diabetes Endocrinology and Allied Multi-Specialities, Fortis Sea-Dog Hospital. Also, we have with us Dr. Gurdas Chaudhary, Chairman, Gastroenterology, Fortis Memorial Research Institute, Gurugram. And we have Dr. Kameshwar Prasad, Principal Director, Neurology, Fortis Hospital, Vasant Kunj, and former Professor and Head of Neurology, AIIMS, New Delhi. It's really a pleasure to have you all with us for this very, very critical conversation. Thank you for taking your time out today for us. Dr. Misra, I want to begin with you. When we talk about the, when we see the shift, rapid rural to urban migration in India, is it associated with the specific metabolic shock phenotype when we talk about, whether it's rapid fat gain, liver dysfunction, also early diabetes. Tell us about that.
So, if you say that our bodies are actually tuned to rural type of lifestyle, thousands of years we have lived in rural type of environment, did hard labor and ate frugal diet. Now that has changed, and the person who's living in rural area, once he moves to the urban area, he quickly acquires several of the acquired factors which adversely affect the metabolism, makes him fat. There is a deposition of belly fat and deposition of liver fat, etc. All this will disrupt the metabolic pathways, increase the diabetes, increase heart attack risk, increase the stroke risk.
So I think that's a very critical point what you said, but at one point we have challenges, increased challenges. Dr. Prasad, when we look at India's life expectancy, that's increasing, right? What are the other health challenges, which you would like to share with us, our viewers today, especially when it comes to the aging population? And specifically again, from the neurological angle.
Yeah, you are absolutely right. Our life expectancy was 48 years when we became independent. Now it has increased to almost 70 years. So we are aging population gradually, and with age there are certain conditions which are associated, and particularly if you ask from neurological angle, then one of the aging population has is dementia. The second is stroke. These two are the most common conditions which come and affect aging brain. But there are other degenerative diseases also, Parkinson's disease for example, and so on. But two very important conditions which affect brain when it comes to aging is stroke and dementia.
So I'm going to ask you about in detail, once we come back to you on that. Quickly, I'm going to ask you, Dr. Chaudhary, about fatty liver. Again, we see a lot of people are getting it. And also there are no symptoms often. And if I can also ask you, how often can we actually indulge in those samosas and jalebis? Are they really difficult, for our system to take it? And what options do people have if they really want to have those?
If I might take off from the last question you asked, Dr. Kameshwar. You see, today, once a person acquires the age of 20 and up, that's adulthood, the major killer is actually metabolic disorders. That's heart disease, stroke and so on and so forth. And usually it's associated with hypertension, diabetes, obesity and fatty liver. So all these things come in a package. So the package is overweight, fatty liver, increased lipids or cholesterol and triglycerides in the blood, proneness for diabetes, hypertension, and that actually drives this whole pandemic, I would say epidemic as of now in India, but all over the world, towards heart disease, and that's the commonest killer. So it starts off often with fatty liver, which is usually ignored. It's just picked up on an incidental ultrasound. So a lot of people would say, oh, I don't have any symptoms. But if you take a closer look, you will find that this person is probably overweight. So, we have an index for that called body mass index or a waist hip ratio. probably this person has a family history of diabetes, he's not doing enough exercise, and that fat, which is totally asymptomatic, is often the first indicator that he is actually prone to developing all these other problems and having a shorter life expectancy.
So it really starts from the fatty liver, not taking care of that.
Absolutely.
Yeah, from the very beginning. Okay. So, coming to fatty liver again, like Dr. Chaudhary said, weight. I'm coming to you for that, Dr. Misra. Can weight loss drugs actually reverse type 2 diabetes? And we also see the number of type 2 diabetes increasing, all age groups we spoke about in rural India as well. Or do you think we're looking, overlooking deeper issues like our environment, our lifestyle, food systems? And do you think, obviously, do you think an injection can solve that?
So, just to reiterate what has been said, the obesity is the major driver, and it's fat over the abdomen and in the liver, which are major drivers for prediabetes, diabetes, cholesterol disorders, and heart attack. If we reduce this weight, we are likely to reduce several of these problems at the same time. So we hit one thing and we solve several problems. Weight loss drug is one option. Of course, there is nothing to replace diet and exercise. There is nothing to replace. No weight loss drug will ever replace that.
So an active lifestyle for sure.
But today, we have effective weight loss drugs. So the last couple of years have shown us that drugs like Ozempic, drugs like tirzepatide, which is also known as Mounjaro, these are extremely potent drugs. And today itself, I saw a patient where over 3 months, the patient has lost almost 15 to 20 kg of weight with Mounjaro alone. So, the rest of the drugs were all taken off. His diabetes is mostly reversed. So, if we lose enough weight, and that has been proven in the several studies, then we can reverse diabetes, provided diabetes is early and provided a person is clearly overweight and obese, which most of the people are. So, these drugs are selectively excellent drugs. Why selectively? Because they don't fit in every person.
So it's person to person and obviously under doctor's supervision.
Also very expensive. So cannot fit everybody's pocket. But in those people who have money, who fit into these drugs, we can reverse diabetes using this drug.
And like you rightly said, timely, going timely and keeping that in mind. And of course, again, I think we can't overlook eating healthy and active workout.
That will go on. That will go on.
That's side by side. Okay, thank you for that. Dr. Prasad, again, a very critical issue I think which we should talk about is the heart, right? So can you tell us, is heart stroke or a heart attack, how different are they and how can one prevent that?
Yeah, there are two different words, heart and stroke. Heart attack affects heart, but stroke affects brain. So that is one thing we should be clear. Both result from occlusion of vessels. So there are arteries taking blood supply to the brain, to the heart. If artery gets blocked, then one gets a stroke. But in stroke, there are other types too. So we call it blockage type of stroke if there is blockage. It's also called ischemic stroke. But if there is leakage, which is called hemorrhage, brain hemorrhage, there are different types of hemorrhages, but there is another stroke which is called venous stroke. And if you talk about stroke, I think taking forward the discussion which we had, stroke is a very disastrous thing. You know, if anybody has stroke, 1/3 people die, 1/3 people remain disabled. So 2/3 either remain disabled or die, only 1/3 recover. So in this situation, prevention is much better than cure. You have heard of this axiom, prevention is better than cure. So how do we prevent stroke? That is very important. So we already talked about certain lifestyle things. Diet has been talked about. Physical activity or exercise has been talked about. But smoking unfortunately in our country, particularly in females, is probably increasing, which is very unfortunate. And smoking is very important. Alcohol, excessive use of alcohol is another thing which creates a lot of problems, fatty liver and hypertension and so many problems.
Lead to the stroke as
well. There are 200 conditions which are associated with alcohol. So remember, this excessive use of alcohol is another very important risk factors. And we talked about stress, or Dr. Gurudas will talk about stress. sleep, these are all important lifestyle factors. And I would emphasize on 4 physiological factors: high blood pressure, high blood sugar, high cholesterol, and high weight, that is obesity or overweight, which we have talked about, and heart disease, certain heart diseases.
So they're all linked.
They are all linked. But if you ask me, what are the 3 topmost factors which we should take care of to prevent stroke? It is high blood pressure, and high blood pressure.
And that is something which sometimes I think people overlook it, you know, when you start the medication later.
We did a survey in Vasant Kunj. Out of 7,500 people, 70% only were aware of high blood pressure. They had high blood pressure, only 70% aware. 30% didn't know.
And that could have led to more serious complications.
Yeah, later, and those who are aware, Vasant Kunj, you know, is educated population, 90% are taking treatment. But only 50% are controlled. 50% are not even controlled.
Yeah, not even taking it seriously.
Yeah.
You know, so I think it's a holistic approach, like you rightly said. Overall, you know, look at it. And Dr. Chaudhary, Dr. Prasad did mention the word stress. So, and at some point in our lives, we've all experienced stress. If you can explain the connection and also tell us a little bit about the gut-brain, you know, axis, and also does stress somewhere trigger, you know, IBS, acid reflux? Tell us a little bit about how stress impacts us, and more from the preventive angle as well.
So there was a time when, you know, if somebody had a problem with the gut or with the liver, they thought it's only there. In the last 15 years, it's become evident that, you know, it's after all linked with the brain. So if you are stressed, so it's actually called the gut-brain axis. So there is a brain which sends signals to the gut or to the liver, or for that matter to the heart. And, you know, if there's a problem there, it sends signals back up, and, you know, it's a vicious cycle. So this cycle is very important, and therefore, you know, it's not just about eating right and doing your exercise. I mean, you know, let me remind the audience also that the last few years we have been looking at a whole lot of people of young cardiac deaths.
Yes.
You know, these are people who are well-to-do, they were eating right, they were going to the gym regularly, but something was not quite right.
So where is the miss?
So the missing link, probably what people think about now, is that stress is a factor. The difficulty with stress is, unlike blood pressure or blood sugar, which you can measure, there is up till now no such thing as a stressometer. You know, you can't actually measure it. And that's the why it's left to a little bit of subjectivity. The other thing which has come in stress is a lot of sleep disturbance. Now they have shown that, you know, people who work on Western timelines but stay in India, you know, they're up in the night and, you know, they're sleeping in the day. So their circadian rhythm goes haywire, and actually that also can cause fatty liver and the whole chain of things that we are talking about. This is called the metabolic syndrome. So stress can't be separated
ignored
out
at all, and it's linked to, in fact, a lot of other diseases that happen. Well, on that note, we're going to be taking a really short break. When we come back, we'll focus on practical preventive measures to help you take control of your health. So stay tuned. Welcome back. You're watching Power of Prevention, and we have 3 experts with us. Dr. Chaudhary, first coming to you again after this break. Is fatty liver a genetic order? What preventive measures would you recommend to someone who's at risk or who's already, you know, suffering or trying to figure out the whole fatty liver, you know, situation when they're going through it?
So fatty liver is actually a combination of a genetic predisposition in some people coupled with a bad lifestyle. So how we eat and how we exercise, okay? So let's put it this way. The genetic pool in the community, say in India, you know, in communities, it's been more or less constant over the last, say, several centuries. But why has fatty liver become so important now? The genes have not changed, but what has changed is lifestyle, what we eat and how we eat. But nevertheless, to improve our understanding, now there has been quite a few developments in identifying genes. One of them is called the PNL-P3. That one actually, if it's there, a mutated part of it, it predisposes you to fatty liver, obesity, diabetes, and heart disease. So would knowing it help? Possibly yes, but would you do the right thing even without knowing it? The answer is yes. So the problem really is that if you're able to keep your weight down, keep your fat from the liver, get accumulated in the liver, and you keep doing your regular exercise, the presence of that mutated gene may not be the critical factor to cost you, to result in an early death. Having said that, I'll just tell you one more thing. This is the way science has progressed. So, we have tried to identify factors, we have tried to find out genes, but at the end of the day, the commonest cause of death world over is actually cardiovascular disease, fueled by diabetes, hypertension and all that. And if if a person crosses his 50s and 60s, it's usually cancer or a degenerative neural disorder.
Yeah.
Okay. So now people have gone the other way around, and they have tried to look at populations who seem to be living to cross 100. It's called centenarians. So there are 5 parts of the world, they are called blue zones.
Yeah, blue zones.
Interestingly, these people don't have hospitals. They don't actually have technically sophisticated healthcare, and yet very pleasantly they go on to be 100, don't have stroke, diabetes, and cancer. So that's the way, the other way of looking at it.
No stress, probably, good lifestyle.
One is stress, but the other thing now which is very important is the food. The food is, they usually take a lot of fruits and vegetables, whole grains. They incidentally don't have packaged foods. And one of the major concerns today is about refined sugars and packaged foods. So
the
I think
hidden
that's
sugars as well.
absolutely. So those are the areas which are really being highlighted now, that how you eat and how you live. And they, by the way, walk miles. And they also have ritualistic fasting. So all those old things are actually coming back.
Coming back, and I hope we can learn and put that a little bit into our lives. Dr. Prasad, I want to ask you about dementia. Again, that's a very important topic which we should be talking when we're talking on our special show, Power of Prevention. Tell us, how can that be prevented?
Yeah, dementia prevention is a long topic, but to remember, I have selected words starting with S. So first S is style of life. So you have learned about style of life, and that includes diet, smoking, alcohol, physical activity, and so on. The second S is social connectedness. Social connection is very important for keeping your brain active. The third S is sleep. Good sleep is very important for brain. The sleep is the time when your memory consolidates. So a good sleep is very important. Stress, we talked about stress. Then stroke prevention. If you prevent stroke, which I talked about, you prevent dementia as well, because stroke is a major cause of dementia, and stroke is connected with Alzheimer's disease, which is also very important cause of dementia. Then psychological factors like anxiety, depression. And that is so prevalent in increasing because of stress, which Dr. Gurdas talked about. And lastly, I should say brain trauma, any injury, whether it is domestic violence, whether it is war zone or whatever kind of, this is a very violent world, these days. So any kind of violence, any kind of trauma, road traffic accidents, young people driving recklessly, all these things are risk factors for dementia. And if you can protect this, dementia can be prevented. But more importantly, actually you can promote brain health. Nowadays we talk about brain health, not only about dementia. And brain health starts right from intrauterine life, which I think you will talk about.
Yes.
And then in the workplace, if there is cognitive stimulation, so job which demand more cognition, cognitive reserve, that way those who have been working in demanding jobs, which is cognitively stimulating, they tend to have less risk of developing dementia. So it is a whole life course, starting from before birth, at the time of birth, during workplace, education, for example, education in childhood, very important to prevent dementia. So it is whole life when you have to think about protecting brain.
Yeah, from the very beginning, so that you don't have any challenges later in life.
Education in childhood.
Thank you for putting that well with all the S's. I think it's easier for our viewers and for us also to understand and grasp that.
Right.
We've, Dr. Misra, we've spoken about, how important diet is, whether it comes to your fatty liver, whether it's about your stroke, diabetes, of course. Tell us and our viewers a little bit about these fad diets. You hear of keto, or do you think we should stick to what traditional UBC, going back to the millets, right? Our Prime Minister talks about it. So what is your take on the food?
Yeah, because these days 10 to 15% of the patients which I get in the OPD, they talk about this diet, whether I should exclude wheat, or I should exclude one particular element in the diet, or go to the keto diet, or go to the vegan diet, and things like that. They've heard somewhere. You know, it's all about a WhatsApp chain and things like that. Now, some of the diets, for example, let's say keto diet, very popular diet. Some of the diets are very good for short-term weight loss, say 3 months, 4 months. And anyway, these are kind of diet you cannot pursue for a long time. So 3 months they lose 5 kg weight, 6 kg of weight, which is good. You have to select the right kind of patient for that. But long term, it has been shown that these diets actually will impair some organ and mostly heart. So recent studies have shown that. So if somebody comes that I want to do keto diet, I say restrict to 2 months. We'll get the blood test done and things like that, and see whether you are eligible for it. And after 2 months, if you're having lost weight, you please come back to me. But most of the patients, 90% of the patients, I say, please have a balanced diet. And balanced diet is our old diet. There is nothing great about it. There is no, you can say, a major advancement over it. What we used to eat in the villages, first question that you ask, that rural to urban, what we used to eat 1,000 years back and in rural. So the whole grains, dal, leafy vegetables, salads, plenty of that, over which if you can add nuts, seeds, right kind of oils, these are good. As far as millets are concerned, you asked about millets. Millets are very good, but not all millets are good for blood sugar. And in patients with diabetes, I would say please restrict ragi and go for jawar, bajra, and one of the best non-millet cereal is besan. I say आप गेहूं भी खाइए, आधा उसमें बेसन मिला दीजिए. Take 2 cups, big cups of salad before. This is called preloading the meal. Preloading. So before the meal, 2 cups of major salad with a lot of flaxseed and a green leafy vegetable. Okra is very good. Okra has been shown to have some property to decrease blood sugar, and some kathal, you know, the jackfruit, and traditional methi, etc. All these, if you mix in proper manner, take plenty of curds, which is good for gut health, and milk, paneer, etc., you will be fine. You will be fine. Mostly doing so. All my patients who follow these diets have not only good control of diabetes, they have good muscles, bones. So we don't talk of muscles and bones in patients.
Which is very, very important.
Very important. And most of our women are very weak in muscles, bones, etc. They build up their bones, they build up their strength, they have more confidence, and their diabetes is also controlled. So look at the all-round benefit of a wholesome diet. This is what we promote.
And I think what you said about ragi, because everybody is into this whole thing of eating millets, but what you said, that's a very valid point, that if somebody has sugar, you know, ragi is not the best millet for them. And of course, what you said, balanced diet, you know, what you can make in your own house, ghar ka khana jaise aapne kaha, I think keep to that.
But one thing, ragi is very high in calcium. So those who have a very big bone, we say eat ragi if they don't have that.
So I think awareness is very important when it comes. I mean, just don't go for a fat diet because everybody is doing keto or doing intermittent.
Individualize the diet.
So I think, yes, individualize. That's really important. So before we wrap, quickly closing remarks from you, Dr. Prasad. You know, when we look at prevention, the most important thing.
Most important is lifestyle. We have talked about diet. I would again emphasize, be away from smoking, not excessive alcohol, physical activity. I would say yoga is very important from our perspective. If we do yoga, which is good for physical health, but also good for mental health. There is now proven by a number of studies that physical exercise is good for brain health as well.
Great. So physical exercise, workout, yoga you specified, Dr. Chaudhary.
I think one myth that needs to be dispelled. You know, fatty liver usually is not a result of increasing fat intake. I mean, fat needs to be curtailed,
Sure.
but it's basically an imbalance between calorie ingestion and calorie expenditure.
Okay.
But the commonest cause of fatty liver is excess amount of sugars and carbohydrates. And actually this is a myth. So a lot of people actually, they go on to a low fat diet, but they are taking a lot of sugars. So refined sugars, be it as sucrose, which is our common sugar,
Yeah.
or fructose, which is the fruit sugar, so fruit juices and all, they are the worst culprits because they are converted to triglycerides which get deposited in the liver and causes that whole metabolic
And we
change.
think juices are healthy, so you're having the right
Juices have actually been proved to be very unhealthy. And the only other two things that I would say, that avoid packaged foods, processed foods.
Okay, so
That's
I think important point. Last word to you quickly, Dr. Misra.
Mike, the message to the viewers are, number one, you maintain your body weight right throughout. And how do you measure body weight? Is by body mass index, kg by meter square. You can calculate yourself, less than 23. If you are less than 23, unlikely that you will develop all the diseases that we have talked about. Number two is waist circumference. Now, your tailor may know your waist circumference. If you don't, then you please measure yourself. Above 90 centimeter in men and above 80 centimeter in women is hazardous for metabolic disorders, heart, liver, and brain.
Yeah, so I think.
So if these two are maintained, you're in fairly good health. Of course, there are several other parameters that need
But
to
very, very important critical information shared by all three of you. It's really been a pleasure to have you with us. And as we wrap up the first episode of Fortis Presents Preventive Edge Dialogues on Preventive Care, let's remember that health is a shared responsibility. Individuals, healthcare systems, and governments must work together to create a culture of prevention. By taking charge of our health and supporting larger initiatives, we can build a healthier future for all. Making wellness a national movement is not just a goal, but a collective journey that begins from each one of us. Thank you so much for watching.